helping people make a different decision on what employee benefits you have was just not the thing that fired me up because the system was just so broken. The answer is usually, well, the costs are going up. So that was what created this drive to go find the healthcare innovation world and the startups, because then you can start thinking about solutions and try and impact the problem at its root cause.
You're listening to What Fuels You, where we deep dive with CEOs, entrepreneurs, and business leaders to learn more about their stories and uncover nuggets of wisdom we can all use. I'm your host, Shauna Swerland, CEO of Fuel Talent, an award-winning recruiting firm based in Seattle. Today's guest on the What Fuels You podcast is Kiser. Kyle is the CEO of Arrive Health, a leading healthcare technology company dedicated to improving patient care and clinical decision-making. With extensive experience in healthcare innovation, Kyle has been instrumental in transforming the healthcare landscape by simplifying access to vital information for providers, payers, and patients. His leadership emphasizes operational efficiency, reducing administrative burdens, and delivering better health outcomes. Kyle is a recognized thought leader dedicated to advancing the transformation of the healthcare ecosystem, using technology to drive meaningful change and create more efficient and effective experiences for all stakeholders. Welcome, Kyle. So good to see you.
Good to see you.
It's been a while. I'm dying to get together in person and have a proper catch up because I know you are like crushing it over there, and I'm excited to get into it with the business, but we're going to start with some rapid fire.
Ready.
I almost called Carly on this one, your wife, your gorgeous, amazing human of a wife, to see if she would tell me the scoop. But I'm curious if you have any nicknames.
Oh, man. We have lots of nicknames for one another that I'm probably not going to quote. I think all of my college football teammates don't even know my first name. Like I think everybody in college called me by my last name. So Kiser, I guess, is probably one. Well, I did have a very successful fourth grade student class president, vice president of whatever, where we used the Special K box as the marketing campaign.
I love that. You're the special K. You're double K.
Yeah, which was, I think Clark Kellogg was like a college basketball and professional basketball player. That was his nickname. So that was what we were playing off there. That one didn't stick, but it was used at one point.
I was thinking the reason why I went with nickname, and I don't ask everybody this, but is because you were a football player. I'm like, he definitely was not called just straight up Kyle. So they all call you Kiser. Are you in touch with any of those guys still?
Several of them. I mean, we lived really far away from where we went to college. Carly and I both went to school at this tiny little place in North Carolina. So when we make it back that way, we see some of those folks.
Okay, what is your favorite sport to play or watch?
Oh, play is football for sure. Watch is usually football. I think right now Mariners baseball is giving it a run for its money though, since we're making a playoff run.
We're in the thick of it. Oh yeah.
Yeah.
Is there, I don't know if you love to read books for fun or for business, but is there a book that you would recommend or that you find yourself recommending often?
Yeah, several. The author I read most consistently is this guy named Richard Rohr, Rohr, who is a Franciscan friar, I guess. And he's kind of a Christian contemplative thinker, but that line of thought is very much like a universalist perspective. He has basically reframed everything. So he just wrote a book. He's got a brand new one that I just finished called The Tears of Things, I think. The Tears of Things.
I'm writing it down. Would I like it? I mean, you know me well enough to know, would I be like, wait, no, or yes? Like what kind of the tears
I
of
think
things I'm writing
so.
it
What
down?
was interesting about it is that it like totally reframes all these stories that you think you know as different ones. And in this case, it was both both Old Testament and New Testament stories in this like contemplative frame, which makes it so much bigger. It was really good. I do oscillate back and forth though. Like I go into those sort of heavier topics and then have to take a break with other stuff.
Of course you do.
A guy on our team recommended this book called Blood and Thunder, which was written by a guy whose name I can't remember. But the story is all sort of centered around Kit Carson, the like historical figure Kit Carson.
Oh, okay.
It was like a mountain man, and this sort of Western legend. There's a mountain in southern Colorado named after him. Even for a time led the Army of the West, or a big section of the Army of the West. And so they tell the whole story of the settling of the West kind of through the eyes of Kit Carson, and that brings in the Native people perspective and the Army of the West perspective, and even like
That's heavy too. That's like
yeah,
real reading also. I'm thinking you're going to say something really light, but like, what are you doing for your like, you need some brain candy. You need some
yeah,
brain
no,
candy
it's
over
true.
there. Yeah. Okay.
Yeah,
Is there a city or a country that you really want to go visit?
I really want to go to Patagonia and like do that Argentina, Chile part of the world because it looks beautiful. That's one that we have on our list.
I would love to also. Is there what is the first concert that you ever attended?
Oh man. I think it might have been the band Alabama. Remember that band? It was like
Oh
a
gosh.
country band in the
Yes.
80s.
Yes.
I think that was one of them. And then my parents were really into beach music, which has a specific meaning when you're from the Carolinas. It's it's like kind of R&B, but not exactly R&B, and has shag dancing associated with it, which is like basically swing dancing, but you don't pick up your feet as much. And so my folks were really into that, and so we would always be at these beach music festivals. So I really
That sounds
remember
kind of cool. They
a
sound
lot of
awesome.
those. I
I've
remember
met
being
Carly's parents. I haven't met your parents, but I'm sure they're very cool also.
yeah, they're fun. Yeah, the most vivid memories from those are basically just sitting sunburnt at a music festival while my parents were
Yeah.
having fun and probably drinking too much, if I'm guessing.
Yeah. So if you weren't in healthcare, or health tech, what industry do you think you'd be in?
I don't know if I ever thought about doing anything else.
This has been your thing. Well, I know you were raised kind of in the like insurance, like that healthcare and that area. So we'll get into it. Is there a word that your colleagues would use to describe you, or three words?
I hope they would say curious, like sort of try and start from a place of curiosity and seeking to understand. I hope, entrepreneurial journeys require some level of courage. So I hope that would be one of the words that they use. And open. I think the thing I'm proudest about of our team and our leadership team is just we kind of operate as this like shoulder to shoulder group trying to get it done. And there's not a sense of hierarchy or status necessarily. We're just like operating as a unit. And so I hope that they would feel that level of openness for me.
I love that. Where does all this, I guess, come from? You started talking about North Carolina. You were raised there, right? Like your whole life?
Yeah. Well, until 23, I guess. Yeah.
Yeah, until you left. Yeah. So what was a typical day in your childhood? You have siblings?
Older brother. He's almost 7 years older than me. So he's quite a bit of distance between us. So he was kind of like almost a subordinate parent in
Right. I'm
in our
sure.
experience. So which was cool. I mean, what was great about that is there was no like competition conflict sort of dynamic between us at all.
He an athlete also?
Yeah, he was a really really good baseball player. He played football, but was I would think he would say baseball was where he excelled. Although
Yeah.
all of us grew up loving football, we took all that way too seriously.
And who are you more like, your mom or your dad?
I think I would have, for most of my life, said I was most like my dad. And the older I get, the more I understand how I'm similar to my mom.
Yeah. In what ways are you like, what attributes did you get from each of them?
Well, I'm kind of in the same industry as my dad and similar skill set, I guess. Like he was broker consultant. There's a lot of business development in that. It's a lot of like going out and beating on doors and meeting people. And that's certainly where I've spent my time. And we're wired in the same kind of competitive way. My mom's a Enneagram 2 and kind of like
That's me. I'm an
is it?
Enneagram
Yeah.
too. Helper, the helper.
Yeah, she's the helper. And I see what I've started to recognize is just her. She's got this like really deep drive to care for people. And that shows up differently in me, but I think the sort of constant push for purpose, like I don't find almost no motivation in just trying to succeed on behalf of just whether or not we can succeed or even because we can accumulate more resources somehow.
Well, in your case, it's like the actual industry that you're in. is changing people's lives. And so, as much as you're probably the competitive guy that was able to kind of bang down doors doing insurance or bang down doors doing, it's like if you were to do that on behalf of some like cloud based blah, blah, having nothing to do with changing people's lives, it might not get you out of bed in the same way.
Definitely doesn't. Yeah, even being in the insurance business, that was people make a great living in that space, and it just didn't feel motivating in the same ways that like helping people make a different decision on what employee benefits you have is was just not the thing that fired me up because the system was just so broken, right? Like it's the answer is usually, well, the costs are going up and tough shit, and
Yeah.
so that was what created this drive to go find the healthcare innovation world and the startups because then you can start thinking about solutions and try and impact the problem at its root
Yeah.
cause.
Yeah. Well, I read in prepping for this that you were, when you get in trouble, your punishment was stuffing enrollment packets for your dad,
That's true.
in the family business. So I'm
That was
sure
true.
that probably either got you excited and curious about the business, or you were, it was just like, oh, I guess I'm just getting my ass whooped right now, and this is what I got to do.
No, it was very much a curiosity. I really that's all I ever thought about doing was just going in and being a part of that business. And
Was it a family business?
it was at first. Well, he kind of hung his own shingle and then joined a bigger firm, and then that bigger firm sold to a bank. And so he spent a good chunk of his time sort of leading the employee benefit practice within that bank. But it did create this like foundational understanding of how things work.
Yeah.
When you're understanding a value chain or supply chain, sort of understanding how the money flows is ultimately how you understand how behavior happens.
Yeah, you'll have to explain it to me at some point because it's very overwhelming to me. I get so confused by it. And now that I have my own company and, obviously I have to pay for all the healthcare benefits and they've certain years because we've got all these contractors, right?
Yeah,
And certain years they just go through the roof and it's nuts to me. Or like certain things that just don't get covered, other things do. I'm like, I don't get the whole decision process. It's kind of nuts.
it is. It's pretty opaque.
Yeah. So your like application process for college, was that all linked to football? Were you only focused on schools where you could go play, or were you just trying to get to the best school and use football as like kind of a way to get a great academic experience?
I was entirely uncurious about my options for college. So I was only focused on, going and figuring out how to play football in college. And
Yeah. What position did you play?
depends on the injury. So I was a quarterback coming out of high school and for some of college, and then had a shoulder injury that prevented that from continuing. And that's when I transferred to Guilford, which was the little school where Carly and I met, and played receiver and running back in
Where were you before Guilford?
Appalachian State in Boone, North
Oh,
Carolina, which
nice.
was where everybody went. That was like the whole family went to Appalachian. I grew up going to those games. It was like all I ever wanted to do was
Yeah.
play for them.
Did you have like a kind of moment of feeling really down when that happened? Because I know for athletes, especially tied to so much of your identity, especially as a quarterback, it's different.
Yeah, I'm there. It was definitely an adjustment. I think what bloomed from that was Boone is in like ground zero of kind of Americana folk and bluegrass music, and so I had just bought a guitar like the summer between the end of my high school years and before starting at Appalachian. I went there early and bought a guitar to take with me and just fell in love with music and the music of the mountains. And I think that also prevented me from going to class very often. Uh, but it sort of led into this new love. Like the inability to go do any football related activities kind of was filled by figuring out the music thing, and it consumed me. So I love that that's what came of it,
Are
and
you still
that's
playing?
yeah, all the time. I mean, for myself.
How did we not know that? We need to like jam or like Carly and I can dance while you and David jam.
I know. That's why I was excited to see the wall behind you. I didn't realize David had all those great guitars.
Yeah, he was in a band in high school and but it's great for the kids to have that energy in the house. I love music and that's great that you
Yeah.
had that outlet because I feel like some athletes it's like I'm either playing, I'm on the field or on the court or I'm off and I don't know who I am or what I'm about and I love that you picked up, music. Such a great outlet.
Yeah. I did find I needed the discipline of a coach and a team to succeed. Like,
Yeah.
was definitively not successful as a student at Appalachian State because I stopped going to class and started playing music, and that doesn't really turn out to give you great academic outcomes. And so transferring and playing football in college was really like the only way to succeed.
Are you one of those people who only focuses when you're interested in what you're learning? If you're taking a class that's just like a prereq and you're like, I don't have any interest in this, where am I going to use this in my life? Is it hard for you to get motivated?
Definitely.
Yeah,
Yeah,
I think most people are like that. We got to redo the education system. It just
totally.
makes no sense. It's like, where are you going to use this? And then you find yourself, and you'll see when your kids get older into high school and college that it's like, you just like, just because, but you don't really want to answer it that way. Like you agree with them.
Totally. I think I would guide my kids to go find like co-op type programs. Like I think Purdue and Northeastern, they're schools that have like built themselves around this. You go
Yeah.
work in the real world while you're learning in college. I
Yeah.
just think that's so much more useful.
Well, I just read an article this morning, even talking about how like college isn't even really that necessary anymore with AI, and just these kids are coming out and finding themselves that all these things that we told them they had to study, whether it's like computer science or get even a business degree, econ, it's like, you know, business analysts and research analysts, all these roles, software development engineers are potentially at risk, which is a whole other crazy
Totally.
conversation.
I actually think there'll be a resurgence of humanities. Like
Yes.
I'm biased because I went to a liberal arts school, and it really like turned my perspective around in a really helpful way. But I think that they teach you how to think, and they teach you to think
Yeah,
independently and critically. It's not that STEM isn't valuable. It's certainly like obviously valuable in so many ways. But I think complementing that with reading a broad variety of things and understanding the human context is going to matter
absolutely.
more going forward, because that's ultimately how technology succeeds, is in the human context.
Well, 100%. I think it'll be even more than ever. I completely agree with you. Are there aspects, I mean, when you're recruiting for your team, and we're going to get into your company, but are you drawn toward athletes? Because there is a certain aspect of an athlete that understands teamwork and understands, you know, discipline and resilience and feedback. Do you find that you're drawn to, or how much do you use your experience as an athlete and what that taught you in your leadership or your ability to kind of pick talent?
I don't know that we do explicitly. I mean, we have several former athletes on the team for sure, and have throughout the years, and they do tend to have that like level of drive and self determination that's useful, but it's also so role dependent, right? That
Totally.
sometimes the like that competitive drive can also lead to a lack of collaboration that is unhelpful in other ways, and so there are roles where that is really useful, probably often in like commercial type roles, sales and BD type roles, but maybe less helpful in things like product, where you basically have to,
Collaborate all day.
nothing but the go between.
Yeah. And so it sounds like even when you were in school and college, you were thinking, I'm going to kind of pursue this career in, you know, benefits and insurance. And so what was the process like? Did you know those top companies that you wanted to pursue? And how was it what you expected? And how was it different than what you had hoped?
I kind of had an idea where I would try and go. And there was this like relatively proven path where you start as a wholesaler selling to and through the brokers. And then you sort of become a broker consultant type that sells to employers like yourself. So that was pretty clear in my mind, is like, go get experience in the wholesale side. You learn the business in a different way, than eventually transition over to then what would have been like the bank where the family business lived now. And so that was a pretty clear path, but I didn't love it.
Yeah. Is it like, here's your phone book, go after it? Or is it, because I know I've been doing sales, basically some form of sales my whole life, like no base salary, just commission, kind of get after it. And
Yeah.
I don't love anybody thinking of me as like a salesperson. I much more think of myself as a person who builds relationships. And if something follows, great. But I've also never worked in an environment where it's like, this is the expectation. You make these 100 calls a day and that's how you're measured. Is that what you were
Yeah.
doing?
Kind of. It was a little more defined, because there are certain, there's in a market. I was in Atlanta. In a market, there are certain brokers and consultants that you're intending to call on,
Yeah.
and they have a certain set of clients, but there is a level of activity. I think the thing that was super useful and is still useful to this day is that you get if you could do that in the environments like you described and what I was in, and you can succeed in these businesses where like the close ratio is 2 and 3%, like you can do this anywhere. You
Yeah.
just build this level of resilience and commitment that helps in lots of other ways.
Yeah. Well, in your case, that's what it did. But in some people's cases, it's like, I can't deal with the rejection and I never want to be in that type of role. But I think when you go into a CEO role from being somebody who's done sales, you recognize that it's super useful to be good at building relationships as a CEO. Like whether it's internal and you're
Yeah.
selling all the time anyway. You're selling the opportunity, you're selling to your investors, you're selling to your potential customers.
It helps to sell something that was almost entirely undifferentiated.
Right, exactly. Like, why do I need to buy from you?
Yeah, because then you have to learn how to build relationships, and that is the reason people do business with one another. And maybe you have to learn how to solve people's problems, right? Like nobody really gave a shit about
Yeah.
which disability or life insurance carrier they were choosing in this case for their employees because they're all kind of the same. But
Yeah.
you could go in and sort of start to diagnose problems with them and sort of be solution oriented, and that's how you differentiate.
And I think taking complicated information and simplifying it for people in that industry is helpful. Like, dumb it down for me.
Yeah,
Just give me the net. How much are you going to pay? What do I get for that? Because it's all a
yeah.
bunch of noise otherwise and a bunch of paperwork. So as you're working through these, larger companies, you worked in that industry for, I think from my research, it sounds like about 7 years.
Yeah.
Were you paying attention to kind of culture, and were you ever thinking, gosh, I wish I could start my own thing or be a CEO and have more influence over culture, making people feel valued? Or were you just like, I'm just try and close deals?
I definitely was. And I think I was often, probably also with the Athlete Foundation, I was often looking for like the mentor relationships and had several really good ones. But then also would have these experiences where like you'd seek this insight from somebody that you saw as a successful person in that business. And they'd be like, well, I don't know, I succeeded because I took these three people to play golf and they did business with me. And it's like such an unsatisfying answer. So yeah, I mean, I think it didn't start as anything I would describe as culture. It started as wanting to understand better why those that were succeeding in that industry were succeeding and trying to understand and probably emulate some of those behaviors. And then later, I can sort of associate how that turned into sort of this wanting to understand how groups succeed together. But at that point, it was just like, I don't know, I'm 24 and I want to know how you got to do what you're doing and how do I
Yeah.
choose to do it that way or find another way.
And great advice. I'm always hoping like some kid is listening and is realizing like it's so much about that. It's just like leaning into the people that are ahead of you or next to you or beside you in any way that you can learn from and staying curious. But you made a deliberate choice to kind of pivot and go into a startup.
Yep.
How did that come to you? Did somebody come to you and like run a job past you, or you were like, I'm done with this and I need to go out and hunt for something?
It was the latter. I think I knew I didn't want to be in benefits, but also just appreciated the value of healthcare in general, and it had this sort of purposeful angle if you did that right, and got really curious about like corporate wellness and employee wellness, and sort of how do you. This all started back with like, okay, costs are increasing, and nobody really knows what to do about cost increasing with the current tools, except for say, sorry, the cost of your health insurance is going up. And really the only solution to that is you the employer start to shift that cost down to the employee, which is probably the constituent that's least capable of bearing that extra burden. And so it made me start wanting to think about why. And I sort of came to these transitioning the system from basically a sick care system, which is what we are today. We aren't a healthcare system, we're a sick care system where we do a really good job of taking care of people that are sick and a really poor job of keeping people healthy. And so that was one. I got this curiosity around like, well, how do you get to root cause on why everybody's not healthy? Price transparency became really interesting to me because it was kind of where we are now. Is it's so hard to understand how much anything costs and how you pay for stuff in healthcare that I'm sure everybody's had that experience. And so price transparency became a deep curiosity. And then access to primary care is just I don't know if you've tried to find a primary care doctor in Seattle, but we moved here recently enough to where I've had to go through all that. And, it takes, as a new patient, doesn't matter where you go, like UW, Prov, Optum, wherever, you're going to wait 9, 10 months for your first appointment with a new relationship in primary care. And so there's this access problem generally. And so those sort of ended up being the three buckets of things that I was really curious about and interested in. And they were all, in my view, those were all tied back to the kind of three of the primary causes of why costs were so inflated. And so corporate wellness and health management became the first bet. So I just started meeting people. Same deal. It's just you figure out who you know and you start asking them questions, and they introduce you to people that they know, and led me to Principal. And Principal was actually kind of an entrepreneurship experience. It was like this team of, it was probably like 50 or 100 at the time, that was the wellness business inside of big Principal Financial Group.
Oh, interesting. I didn't realize that. There were so many people trying to solve that exact, I mean, a lot of this in Seattle at that time. I can think back a
Yeah,
lot
yeah,
of
you're right.
companies that didn't quite make it, but such a tough nut to crack. I mean, what you're talking about, it's almost like talking about like homelessness or something. I mean, it's such a big thing
Totally.
that is honorable. I like what you're building now. I mean, I know you went through a few different startups. Again, like were you making a list and going after the companies, or is that all just through networking or
It was kind of both. Those three main categories have persisted. Like that, those are the places where I'm most curious in our space.
yeah.
But then it also was networking. So I had this unbelievable mentor who was the president of Principal Wellness Company. This guy named Lee Dukes, and he's just like the best leader I've ever been around. He's just one of those people that is curious and empathetic and humble, and he was just like an unbelievable leader that I wanted to learn to be like. And I wasn't there long. He went to Catapult, and so I eventually followed him.
Oh, so you followed him to Catapult. Okay, cool. What did Catapult do?
They were doing primary care at the worksite. So it was that access to primary care category of things that
Yeah.
they were pursuing. And then Welltalk in between was I think when I joined, they were billing themselves as like social media for healthcare, just to give you a sense of how long that was ago.
Yeah.
That was like a new thought, but consumer engagement for healthcare around health promotion, I guess, generally is
Yeah.
how I would describe it.
Yeah. And how did you find out about the opportunity? Let's just call it Arrive Health because that's what we're calling it now. How did you
Yeah.
find out about that opportunity? Did you meet Dr. Kevin O'Brien?
I knew I wanted to go early. It was actually, who was it? It was the COO of Welltalk. Actually, I'd moved on from there, but stayed in touch with all those guys. And I was looking for, I'd been an early employee at several places and wanted to be
Yeah.
like at the origin of something.
Yeah.
And it was actually Carm that I got introduced to, who was our original CEO. So the COO of Welltalk introduced me to Carm and said, they're thinking about this pharmacy thing. And so the dynamic was, Carm was like a Boston product guy that had moved to Denver, and Kevin was the clinical leader. And so I guess my contribution in this was somebody that understood how money flowed in healthcare. That was where I was adding value.
And what was the business model at that time? And what is it the same as what the business is doing now?
Oh no, I don't think there was one at that time, to be honest.
What was the idea behind the business?
So the original story is Kevin, who was the clinical founder. He's a doctor in Denver, still a doctor in Denver. He actually was approached by his mom, and she had this high out of pocket spend, and he was like any good son with the capability to help. He helped, and he took the meds that she was on and found these alternatives or different ways, like a branded med could be broken into generic parts, brought these solutions forward for her and cut her spend in half. And so what that inspired him to do was start doing this work in his own clinic. And so he accumulated this massive spreadsheet of ways to save on medication. It was like the original content set. So he was going to self-publish a book on Amazon with that content set of ways to save on medication. But the way that medication pricing works in the US is pricing is changing constantly, and prices aren't consistent from location to location. So like the CVS across the street from the Walgreens are probably going to have two very different prices for that medication. Almost certainly going to have two very different prices for that medication.
That's so crazy.
And it might be different Tuesday and Thursday, like it's that variable.
Really?
Mhm. And
Ew.
it's become a lot more standardized as rules have changed and market pressure has been applied. It used to be that your pharmacist was not allowed to tell you if there was a lower cost price for you, if because the insurance contract required that they only communicate the insurance price. So if you walked
Wow.
into your local pharmacy and you were and your insurance price was $50, but that pharmacy could sell it to you at a profit for 25, then they were not allowed to sell it to you at 25 because they had to honor the $50 price that they negotiated to be in network with the PBM. So anyway, all that is context to say the book would not have been very useful, and it needed to be an API. And so that was the original thought, was like we know that we need to help make prices more transparent. We know that we need to help people find ways to save on their medication. Kevin's been successful doing this in his own clinic. So how do we translate that experience into something that can scale? It took a bunch of forums. I mean, there were zigs and zags, certainly, to try and figure out exactly how we were going to apply that. Some of that was trying to do it with consumers. Some of that was trying to do it with employer groups. Neither of those things necessarily panned out. What eventually succeeded is it's a great lesson to like stay true to your initial sort of founding premise, was that it's really the provider and patient encounter that is the most powerful leverage point. And that's where things start and typically either go really wrong or really right for the patient from a pricing perspective. And the doc doesn't have any visibility to how much the meds cost.
So you talked about how Kevin's like origin story, he was helping his mom save money and then he made the spreadsheet. And then the company mantra became Lucy Up. Can you share more about that story and how Lucy is, I guess, woven in to the business? How often are you talking about Lucy?
I mean, we honestly start every customer meeting like this is how we live and breathe. We give up Lucy Up Award every month. It is the thing culturally that sticks the best. And I think the reason that's true, that's the story with Kevin and his mom, Lucy, is this one that everybody's had some level of familiarity with, right? Like everybody in our company and probably anywhere, and everybody listening's had some experience, or their family members had some experience where they couldn't afford meds, or they couldn't access it, or it was confusing, or they didn't know where to fill it. Like it makes this somewhat abstract aspiration really personal. And so it's been definitely the most durable kind of cultural element to our business over the years. Is that even as we transition the brand from RX Review to Arrive Health, we just changed the colors on the Lucy poster from blue and navy to purple and purple that we are now.
I love it. And I loved researching it because I also feel like when you talk about Lucy App and you talk about a human behind it, it does make it so much more relatable. And it just kind of sums up the whole entire mission. And especially because it's woven into your values, putting the patient first, like Lucy is everybody's patient.
That's right, exactly.
So you're selling into the doctors?
Yeah. So the way the core product works is that we integrate with the software that doctors use to prescribe. So those are called electronic health records or electronic medical records. And so think of it as the CRM that doctors use. So we are this data network that when they go to prescribe, we tell them how much the medication they're intending to prescribe costs based on your insurance. And then we recommend lower cost alternatives that are either in relationship to your benefits. So like the insurance might have preferences where they're trying to prescribe A, but B is clinically equivalent, but something they've, for one reason or another, negotiated a better deal on. So they will recommend that. Or oftentimes there are network restrictions. Like if you get your benefits through a certain PBM, they may own a pharmacy and they may have negotiated a narrow network for better pricing to get you to go to that pharmacy. Doctor has no
Mm.
idea. And so we are a way for the provider to understand that at the point of decision so that they can then switch. And then you don't have to go hunting and figuring out, walking in the wilderness to figure out exactly how to pay for your meds.
Yeah, it sounds like it's otherwise just complete wild, wild west. And so
Totally.
the business model is you get paid by the doctors.
No, it's free to the user. So it's almost, think of it as like an advertising network.
But how do you make money?
We think of the world in terms of supply and demand. So the users are the demand. We get paid by the supply side. So that might be health plans and PBMs that want to provide the insurance pricing for you. That might be folks like GoodRx that want to provide cash pay or a discount card price for you. Sometimes pharma has sponsored programs where, if you see the pharma commercials on television where it's like, call
Mm,
this number to get
yes.
as low as $0 or whatever. Those types of things we integrate with. And so anybody on that's a source of pricing information is who pays us. And then it's free to the user. So we integrate on that side at no cost.
And how did you bootstrap it? Did you raise funding out of the gate? And where are you as far as your stage of growth?
We mostly raised from angels for a long time as we were doing that kind of zigzagging and walking in the wilderness, figured it out. And so we raised on a note for a while and then found the best partners for us were to work with big health systems as investors and collaborators. So UC Health in Denver, like not California, but Colorado, UC Health was a big important investor. And they had this care innovation center that we kind of were almost incubated within. That's where the product really became hardened and scalable. Providence here in town is an investor. UPMC, which is University of Pittsburgh Medical Center, which is really prestigious
Wow.
university on the East Coast, is an investor.
Some great, it feels very strategic and
Yeah,
aligned. And do you have competitors?
we compete with this one company that's kind of the legacy e-prescribing network in the industry, and so they've been around since 2002, I think. And so the industry came together and kind of created this e-prescribing network when they were trying to get e-prescribing off the ground. And so they have an offering similar to what ours does. We would be happy to describe all the ways we're better for 100 reasons, but that's the primary competitor. So it's like us competing against the status quo.
Yeah, that makes sense. And what's been the hardest part about getting traction? Because it sounds like now you have figured out and you're in the right lane and now it's like go time to go scale.
Yeah, it's grown super fast. So like into 2019, we were probably doing 3,000 transactions a month, and we'll do 27 million transactions this month.
Oh my gosh.
Yeah,
What?
it's
27 million?
yeah. So it's been a good trajectory and a lot more ahead. I mean, I think the adoption we're seeing is only accelerating. So there are some things that happen that are helpful. Is CMS, which is the Centers for Medicare and Medicaid, mandated the use of our types of tools. So that's both for us and our competitors. So they said if you're a Medicare plan, you have to be able to integrate with the real time benefit tool, which is the category of things that we do. And if you're an electronic health record system, you have to have a real time benefit tool. So that obviously helps in healthcare. And so that was part of it. And then within that, we've just built a superior product.
It sounds like it. And just looking at your values, I'm not sure at what point in the business you established your values or if you change them often, but I just want to read them. Prioritize the patient, take disciplined risks, do what's right, win as a team, and relentless improvement. When did you guys come up with those values and how often do you adjust or change them?
We've only revisited values twice. These we did the thing that everybody said not to do in COVID, which is put the entire company on an all-day meeting and talk about values. Uh, but it was 2020. It was when it was right before we started to really scale from a volume and employee perspective. So it was just felt important to get those right at that moment.
Yeah.
And so it's largely come out of the team too. So we did that as a big full company collaborative experience. And how do we represent not just who we aspire to be and how we want to operate, but who we are. It was like it was a thing at that point. We had 15 or 20 employees at that point.
And how many employees do you have now?
44, I think, this week.
Wow. And is there an example of a disciplined risk that you are proud of or one that maybe didn't work out?
Oh man, so many.
I mean, we could talk about the wins.
Yeah, no, they're both instructive for different reasons.
Yes.
We did a bunch of work. What we do primarily is price transparency for pharmacy, right? So pharmacy benefits. We've run at some opportunities on the medical benefit side, so things that aren't drugs like labs and radiology and those sorts of things, and thought that was another big segment that we would pursue at one point. That was an important bet to place, but the market wasn't quite mature, both from a connectivity side and and a user receptivity side. Like neither of them were ready. So that was one where we learned a lot and had to refocus and had to make hard choices and made a turn with the business. And since we did that, we've tripled the size of the business. Like since making the hard decision to step away from that thing and refocus on the core, it's been up and to the right ever since. So that one was a good lesson and certainly represented the values.
Yeah, definitely. And is there I guess, something that you're currently trying to improve since that's the relentless improvement?
Yeah. So the core of the tool, this gets a little in the weeds. So poke at this if it doesn't make sense and I'm using too many healthcare
I like
acronyms.
it. I like it when at least it's an industry I can kind of wrap my head around. Sometimes I'm interviewing people, I'm like, I don't know what the hell you do, and I'm going to pretend and I'm
Yeah.
going to just poke holes. But no, I think it's helpful. And if there's people listening, it's helpful for people to hear this, and I can ask the questions if I don't understand.
Yeah. So the core of our main product, which is the real time benefit product, we do a bunch of things now, but real time benefit is still the majority. The core of our main product is to the relentless improvement point. There are data problems on both ends of the network where the language that EMR uses to describe a drug is different than the language that the claim system uses to describe a drug. The problems with that data compendia are different everywhere you go. So like the one at Providence is different than the one at University of Washington Medicine.
Interesting.
And that's true across the entire country. And the way that works today, the way we solve that problem as an industry today is that they send whatever they want to the pharmacy. And the pharmacist does this really valuable thing that is underappreciated, which is run a bunch of test claims and figure out which one of them is the right answer. So there's a human solving that problem inside your pharmacy today manually. And so in order to do what we do, you have to then be able to replicate what that human does in a sub-second transaction. Otherwise, you can't get a successful response from the claims adjudicator. And so we've built this learning model into the tool.
Yeah, I was going to say, I hope that you're going to use AI here.
Yeah,
Okay,
and so
good.
that's the goal. So the goal of that is to take any of the drug forms out of the EMR and be able to translate those into the things we now know are important to the claim system and translate them back so that you can get a successful response. Because there are no more finicky users of technology than physicians. Like if you, one of our board members was the chief innovation officer, now the chief medical officer at UC Health. He gave us this mantra that it's like has to be fewer clicks, not less, not more clicks. Has to be easier, not harder, and has to be right every time. Like that's the standard, which is really hard to do in our business. And I don't claim that we're right every time, but just because there are certain data limitations that make that not necessarily true. But that's the goal. I mean, and we've
Yeah,
gotten to like a 99.5% transactional success rate at this point.
that's incredible, especially considering you're doing, I mean, on your end, doing whatever you said, 27 million
Yeah.
transactions a month. At that scale, I'm guessing you're learning. And are you measuring the change in behavior that you're seeing when people are given the right data?
Yep. Yeah, we do. And we found that we're about twice the industry average. Our tools are generating twice the behavior changes as anyone else that's in the industry. It's for a variety of reasons. It's not as often as you'd think. So I guess the one thing we should take away from this is almost all the time your doctor is making a good decision on your behalf. It's just when it gets complicated, it's really consequential.
Mm-hmm.
Meaning there's probably 95% adoption of generics, right? So most of the drugs that are prescribed are generic, meaning they're probably $0 on your insurance. But 2% of prescriptions represent 50% of spend in the US.
Oh, wow.
And so getting them wrong in that 2% category are extraordinarily high consequence. And so we spend most of our time on that, like deep in the weeds on the data exchange, because that's the stuff that's complicated to price. And not getting that right is really consequential to a patient.
I can imagine. And also, I know that there's reasons why people don't even get their meds, pick up their meds, or take their meds. Is cost the biggest driver of that?
It is, yeah. The number one cost of primary non-adherence, which is the fancy healthcare term for not taking your meds. And it's about a third of the time people just walk away because they can't afford it.
That's just so beyond sad and scary. Interesting. And where do you think kind of the industry as a whole is going from a tech and policy perspective, or like what do you think is going to be kind of on the horizon in the health tech industry?
How many ways can I say AI?
Yeah.
Well, let me take on pharmacy first, because I think pharmacy is the thing that's under the most change. And all of this is going to sound very antiquated because it is.
Yeah. Well, I'm just the question I'm asking is from the perspective of the consumer.
Totally.
Like, how will I experience pharmacy and medicine and health tech differently in the next 5 years?
The way I describe it is I think that our goal is to create a network that can enable for the first time consumer choice at the point of care and throughout the patient experience. Is that what's already happened in the way you pay for your healthcare generally is that shift that I was talking about from employer to the patient. Like we've already shifted all the cost onto people. Is that deductibles used to be hundreds of dollars, they're now thousands of dollars. Out of pocket cost for drugs used to be $5, now it's hundreds and thousands of dollars. So like the cost has shifted, but the marketplace to create competition within that out of pocket cost is really just emerging right now. And so I think the thing that patients will likely experience is consumer choice for the first time. And it's happening all over the place. Like, I mean, this week Trump RX was announced. So there's that. So like
Can you explain Trump RX?
it's a cash pay solution with Pfizer and the White House that they've just negotiated. But Lilly Direct has existed for several years to a great deal of success with GLP-1s. Novo Direct doing the same thing. Hims and Hers, Roman, GoodRx, all of these companies are in the category of cash pay solutions. And so that was unheard of 5 years ago, even 10 years ago, that those would be a predominant way people are paying for their meds. And that transition is only going to continue, is that everything within the deductible, which is the portion of your healthcare you have to pay for before the benefits start working, are all of these cash solutions are going to show up where it's, you're the one making the decision as the individual, and you're going to have a lot more control and a lot more options within that context. And so that's why we're having to build a much more configurable and adaptable network. So that's, I think, the big change is that, people are going to have more options and ways to pay for things. But they're also going to have more cost share. It's inevitable.
Yeah. Well, that's good. I mean, it's hard what you're trying to do because obviously the industry, healthcare is a profit-driven system. And your
Yeah,
mission is about access, is about transparency, is about affordability. And you're
totally.
trying to balance all of that at the same time.
Yeah, it's both profit driven and profit constrained, which is part of the problem. Is that the law is that if you're a health insurance company, you have to spend 85 cents of every dollar on healthcare services, right? So if you're a public company and your max potential profit margin is 15%, which in truth, all those administrative costs have to live in that 15%. So they're really only like 1 to 3% profit margin businesses. And you're a big public company, the only way to grow is to get bigger, right? And so that's why you've seen these conglomerates emerge, because it's really the only option if you're a big public company, that you have to continue to grow the size of the pie by offering more things that are healthcare services or getting more customers on the health insurance side.
Oh my
So
gosh.
it's both that it's for profit and constrained profit at the same time, which creates this really odd dynamic.
Yeah, I would imagine that that's challenging. And so, based on where you are today and where you're going, what does the next several years look like for Arrive?
We're doing a bunch of things. We're taking a really hard look at prior auth. So prior auth, I don't know if you experienced a prior auth, but a prior auth is you have to get permission from your insurance company to get access to certain really expensive meds. And that today is a largely manual process. Even in the scenarios where it's a digital process, it's really just, a portal used by a person to help make that process go faster, but it's not automated in any way. So because of the work we're doing with price transparency at now really significant scale at the point of care, we can leverage that to then start to automate some of the prior authorization processes. That's probably the other answer to your question of what's going
Of
to
where
change in
things are
health.
going? Yeah.
Yeah, and is that interoperability and data liquidity in healthcare is a big problem, and there's been dozens of efforts to change that over the years, but there's a lot of momentum in that world right now. And AI is a super useful tool now because it's not just the availability of the data. In the past, it's been the availability of structured data, which could drive automation, which now, generative AI can just solve that problem. So that's going to be the change, is that processes that would take, your provider sending something to your insurance company, who sends that to a benefit manager to make a decision and then make its way back to you. That probably takes 2 weeks sometimes. Those are things that you can start to condense to hours. And that's a really good thing. Like that's the way it should work.
Yeah. Well, especially if somebody's, sick or dealing with something more urgent and there's not much time for them to deal with waiting. I mean, it's just frustrating for people.
Totally.
And scary for people that can't afford it, and they're waiting and wondering if they're going to, get the help that they need. So what do you do with all this extra time that you're getting from AI? How are you spending your time outside of work? And like, how do you, I guess, decompress from all this? You got a lot on your shoulders.
I do love the music thing. So I haven't done this all summer, but in the spring I got in the habit of going to like the open jam down at the Little Red Hen in Green Lake. I don't know if you know that place,
Oh
but it's like
yeah.
there's
Yeah.
like a little honky tonk bar in Green Lake. You just go and play with the band.
We had an au pair that lived with us years ago from Brazil, and she would go to the Little Red Hen on Monday nights and like do red line dancing or something.
Yeah, totally. It's such a cool scene. It's like
I need to
little,
go. Let's go there.
yeah, we should go. It's a
Okay.
blast. And I think they might be not, there's a risk of them not being around much longer or something. I haven't
Oh,
looked into it much,
well,
but
let's go before they close.
so music is a big part of it. And then kid stuff. We spend a bunch of time on the sidelines of soccer games and flag football games and
I'm
baseball
sure.
fields.
Yeah. Do your kids understand what you do?
Probably not.
You do a good job of explaining it, though.
Thanks.
Yeah, you do.
Yeah, yeah. No, I think if they ask my kids what I do, that I do Zoom calls and get on airplanes. I think that's probably what they would think I do for a living.
Yeah. And are there any routines as far as like keeping your own health, your physical health, your mental health strong and steady while everything's kind of flying at you from a business perspective?
Just consistent exercise. And I go in waves of having very consistent contemplative practices. Sometimes they're very consistent and sometimes they're non-existent. Um, Definitely like either running or just getting in the gym.
Yeah.
Find a way to do something every day is the way I stay mostly sane.
Yeah. Right. Find movement every day.
Yeah.
I agree. Okay. So, Kyle, my final question for you is what fuels you?
Mostly just want to be a good husband and a dad is probably primary.
Good job. Carly's going to send me some money now. Oh, look at that.
That's
It just came through. Just
perfect.
kidding.
Yeah, no, I think primary, that is it. I mean, I think as I think about focus, that's certainly something that if those things are right, everything else can be right. But I also really like to compete, and I like to work on behalf of the underdog. That's like we were talking Enneagram earlier, like I'm an Enneagram 8. I'm motivated by like trying to champion the interest of the underdog. I'm much more motivated by working in resistance of some injustice than I am even for some great justice. Like I would much rather be in that, like, we're going to battle it camp. And so that totally fuels me in this business. Is there's a bunch of legacy stuff in this industry that doesn't make any damn sense. Making that different is what fuels me.
Thank you for listening to the What Fuels You podcast. If you'd like to check out past episodes to hear from more business leaders, go to fueltalent.com/podcast. And if you have a minute, please leave a review and rating on your favorite podcast app, or share this episode with a friend or colleague. Please share any feedback or interview suggestions for other guests by sending a message to podcast@fueltalent.com. I'm Shauna Swerland, and thanks again for listening.